Pinnaplasty means a plastic surgery operation on the external ears, the pinny. Now, there may be a number of reasons why you want to operate on the ears. The most common is what we used to call batias, or prominent ears, where the ears stick out. But sometimes the ears may be misshapen, and sometimes there may be a certain part of the ear that is not quite right. So you have to be able to understand how the ear is formed and the shape of the normal ear to be able to correct it. I was trained in both the UK and overseas, particularly in Paris, on how to create ears for patients who don't have any. Now, why would you not have any ears? It could be that they were removed by injury, they were removed by surgery if there was a tumor, or simply that you were born without external ears. Some of the best ways to create an ear involved more than one procedure, and I use ribs to carve the ear shape, and then place it onto the outside of the scalp where the ear should be. That's a much more involved and intensive series of operations, but much more commonly I therefore treat patients who've got prominent ears, who've got large ears, who've got asymmetrical ears, who've got bits of ears missing, and any of the above. Basically, we would have to have an assessment, a consultation, find out what is not quite right, and then I will discuss with you ways to treat it. For prominent ears, there are classical operations that work really well. I have actually my own technique that's published that I believe is as good as or superior to traditional techniques, but is also safer. I can undertake prominent ear correction surgery for patients under general anesthetic in the hospital, but I can also treat you under local anesthetic as an outpatient in the clinic.